Have you ever wondered how the dentist keeps you comfortable during your procedures? And did you know that there's different types of anesthesia? In this video, I'm going to go over 6 different types of anesthesia at the dentist. I'm going to go over how they work and which one might be the best one for you. So the 6 types are 1, topical anesthesia, number 2, local numbing, number 3, which is nitrous oxide, 4, which is oral sedation, 5, IV sedation, and 6, general anesthesia. So let's start with number 1, which is topical numbing. So topical numbing is like a gel or a cream that is put directly on the gums where you want to get numb. This is really good for really mild cases that don't take so long. So for example, if you're getting your teeth cleaned and you're kind of sore in one spot, you can put some topical jelly by that spot and it'll be numb for like a few minutes and then you can get the area clean. Or a lot of times this is used for kids when you just want to numb one spot and you want it to be numb for just like 10 minutes and the whole procedure can be done within 10 minutes. You can use a stronger version of this topical numbing. This is really cool because it doesn't involve any needles or any injections and it lasts for a very short amount of time. Now, most often this is used first before an actual injection. The injection is what gets you super numb, but this is what gets you numb so you don't really feel that injection. The limitations with this is you can't really use it for too long and it's not super strong. So if there's like a very invasive procedure like a root canal or a crown or something like that, or even a dental surgery, then you cannot rely just on this. But that brings us to number 2, which is local numbing. Now, this is the most common form of anesthesia in the dental office. You might have heard of different types of this numbing like Novocaine, which isn't really used anymore. Nowadays, the most common one is lidocaine. There's also things like articaine or mepivacaine. This is the one that people are most scared of because it involves that injection. You're telling me you're gonna put a needle in my mouth? I get it. It can be really scary to have a needle put somewhere in your mouth. And it's easy for me to say because I'm gonna be the one doing it. But trust me, it is not as bad as you think. And I say that because I've had it done to me before. Not because I've had a filling. I've actually never had a filling before, never needed one, luckily. But in dental school, we practiced on each other before we practiced on real patients. So I know the feeling of having a needle put in my mouth. And I've had it done by people who were not really well trained because it was their first time doing it. What you gotta know is nowadays people use this topical jelly before doing any sort of numbing. So that area is already gonna be pretty numb before that needle goes in. And the second thing to remember is you don't really feel the needle in the first place. Any pain you feel from local numbing is not from the needle, it's more so from the pressure of the anesthetic entering the tissue. And the other thing you feel is as that numbing gets in the tissue, sometimes that kind of stings a little bit. Luckily, there are some techniques to minimize this. So the slower someone goes when they're actually numbing a spot, the less you're actually gonna feel it. But the most common problem with this type of numbing is people are anxious. This is what they dread coming into the dentist for. They hate this part. But just know that once this part is over, that whole area is going to be super numb that you're working on. Now, depending on where you're getting numb and the type of anesthetic being used, it's going to vary how long you're going to be numb. For lidocaine, the most common, you're probably going to be numb for 2 to 3 hours. Sometimes you'll be numb longer, sometimes you'll be numb a little bit shorter. It kind of depends on the person. Sometimes people metabolize it really, really quickly and they need more numbing halfway through a procedure. Sometimes people stay numb for all day and they don't get numb until they wake up the next day. It kind of just depends on the person. But what you gotta keep in mind is the more anxious you are, the more pain you will feel. And there's studies backing this up where one person getting the same thing as someone else, when someone is anxious, it triggers a pain response in their body. So even if the same thing is happening for someone that is not anxious, for someone that is actually anxious, that person who's anxious is gonna feel a lot more of that pain. So it's really easy for me to tell you to just stop being anxious, but that's not really practical for a lot of people. And this actually brings us to number 3, which is the third form of anesthesia, and this is nitrous oxide. Now, nitrous oxide isn't really numbing. It's not like a type of anesthesia, but I still put it on this list because many people think it is a form of anesthesia. This is also commonly known as laughing gas. It's a thing that you inhale through your nose, and it's supposed to make you feel way more relaxed, and sometimes it makes things feel a lot more funny. The only thing that nitrous oxide does is it relieves anxiety. It doesn't do anything for pain, at least directly, because like I said, when someone is less anxious, they're not gonna have as much of that pain response. So even though it doesn't directly do anything for pain, it still will help. So if you are someone that you know is very anxious coming to the dentist, this might be a good idea for you. And a lot of dental offices offer this. So you can ask about this. And if you get this, plus again, that topical jelly that I talked about, you hardly will ever feel any injection or any needle. Now, the one caveat to nitrous oxide is if someone is super, super anxious, like if you have like mild to moderate anxiety, it works well. But if you are super, super anxious, like to the next level, then it doesn't really work so well. Once someone is at that point where they have very severe anxiety, nitrous doesn't really work as well. So for those types of people, which is a little bit more rare, but we have other options, which I'm going to get to in a second. But going back to nitrous, the benefits are that it's going to wear off very quickly. By the time you're done with the procedure, you're going to be inhaling just oxygen for about 5 minutes, and that's going to flush out all of the nitrous in your system. So after you're done, you're going to be back to normal. You can drive after, you can do whatever you need to after, because all of it's going to be out of your system. The other thing with nitrous is for some people it is contraindicated, meaning they should not receive nitrous. For example, if someone has COPD or if they are pregnant, they're generally recommended to avoid getting this. So it's something you should discuss with your dentist or your doctor and make sure that you inform them of all of your health history, whatever medications you're taking, and make sure you actually update your health history correctly so that whoever is providing you nitrous knows that they're doing the right thing. Now, number 4 is oral sedation. Again, this is not really a form of anesthetic, but I still think I need to group it in because a lot of anesthetic kind of gets tied in with anxiety. This is something where you take an actual pill or a syrup before the procedure, and this is really going to help with those severe anxiety cases. So some of the pills you might have seen are things like Halcyon or Valium, which are really common ones to help with this. The other benefit of these is for cases that are really long. Like if you are going to be in for a really long procedure and you are super anxious, the nitrous sometimes doesn't cut it. It kind of wears off after some point, even if you haven't tapered it or anything like that. And for something like this, it's probably better to have a higher form of that sedation. A lot of times with this, you'll take one pill the night before the procedure and then again one pill an hour before the procedure. Now with this, it lasts for a long time, and you're going to be a little loopy. So you definitely do not want to drive or do anything dangerous while you're on this medication. So you definitely want to have a driver with you when you come to the procedure. Now that being said, you're not going to be asleep. You're going to be fully awake, but you're going to be very, very relaxed, and you're not going to be your actual self. Like you're still going to be yourself, but you're not going to be able to do important things like driving or something like that. Now, number 5 is IV sedation. This basically takes oral sedation to one step further. This is also called conscious sedation or twilight sedation. Basically, it involves this medication administered through your vein, through an IV, and it gets you a deeper, deeper sedation. This is really common in oral surgery. So things like removing wisdom teeth or doing implants or extracting a lot of teeth at once. And just like the name sounds, you're kind of in a twilight. You're not 100% asleep, you're still awake, but you're gonna be really, really loopy, and you're gonna be kind of in and out of things. And you're probably not going to remember any of the procedure afterwards. With this, like I said, a lot of times it's done at an actual oral surgery office because they have more resources, because you're probably going to need to be more monitored during this because it is more involved. And again, you 100% need to have a driver afterwards. And that brings us to number 6, which is the last one, which is general anesthesia. This is where you are completely unconscious. Now, this is usually done by an actual medical anesthesiologist because this involves a lot more even than compared to the IV sedation. Now, this is really rare in a dental setting. Even the IV sedation is really rare in a dental setting. But it's usually done for very complex surgeries, and sometimes the oral surgeon will bring an actual anesthesiologist in just to monitor the patient while they are asleep. It's also done for people who have extreme phobia, who will not even come to the dentist unless they are asleep. There are some people out there like that. Also, it's done a lot of times for special needs patients or children who have extreme anxiety but need a ton of work done. These are usually done in a hospital setting. Generally, for something like general anesthesia, you're gonna be doing all the procedures at once. Like whatever cavities or extractions or whatever that person needs done, it's all gonna be done at once. Because once you're asleep, then you wanna make sure you don't have to do that again. So you're trying to get everything done at the same time. Now, just so you know, all of these options will still involve usually that local numbing. Even if someone is under general anesthesia and they're completely asleep, a lot of times they'll still put local numbing in that spot. You might wonder why. Well, it's usually because once that patient wakes up, you don't want them to feel that pain that you just worked on. And it's a good idea to at least get that spot numb that you worked on so that when that person wakes up, they're still kind of recovering from that. And that gives them time if they need any medications or anything like that, for like any painkillers or something like that, that they at least have time to go get those and they're not gonna be feeling any pain. Now, this doesn't always happen. I'm not saying you're always gonna have pain after certain procedures. I'm just saying generally, you're still gonna get local numbing, especially with like the IV sedation and the oral sedation and the nitrous. Those are all done just to ease anxiety before you come in so that the whole process is easier and that local numbing process is still easier. And in terms of which one's the best option for you, there's no right answer for anybody. I know people in my office that get implants and full mouth extractions done and they don't even have the nitrous, they're just under local numbing. And at the same time, I know people who just need 1 or 2 fillings but have to go under general anesthesia. They have to go to a hospital setting or something like that just in order to get that treatment done. So it really depends on your situation. I'd recommend you just go and talk to your dentist about the different options that are available, and then you can choose which one is best for you. If you really don't care and don't really mind going to the dentist and don't have any problems, then yeah, this local numbing and topical is gonna be best for you. If you have a little bit of anxiety, then you can try that nitrous. If you are extremely anxious, then we can explore some of these other options. Now, with that being said, have you ever had some dental treatment done? And if you have, let me know which one of these options was done for you. And as always, thank you guys for watching. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Did you know that your gums could be telling you a lot about the health of your mouth and even a lot about the health of your body? You talking about this chewing gum? No, I'm talking about these gums. One thing that dentists or hygienists do at routine checkups is something called periodontal charting. You might have seen periodontal charting or had it done to